Namaskar and welcome to India Science. It is indeed our endeavor to raise the scientific temper of the citizens of our country. We bring to you today a candid conversation with the man of the moment, Dr. Randeep Guleria, Director, All India Institute of Medical Sciences, and he will answer all the questions that India is looking at and how we are battling the COVID-19 pandemic. Many thanks for joining us, sir. Welcome to India Science. And my first question to you would be regarding the containment zones and how aggressively are we following the same, and whether it is the green zone or the red zone area, and how effective do you think are lockdowns to kind of, not let this scale up further?
So I think it's very important for us to understand that in many areas in our country, there are clusters or increasing number of cases happening. And like you said, these areas have the potential of spreading the virus to other areas which are relatively green or orange, if I may put it that way. And therefore, it is very important that in these areas we have very aggressive containment zone strategy. That means that there should be a total lockdown in these areas. There should be a house-to-house screening for anyone who has COVID or corona-like symptoms, flu-like symptoms. He should be tested and should be isolated so that the chain of transmission is broken and infection from that area doesn't spread to other areas, then it comes down in these areas. If we are able to do that and we are able to map it properly, whether it be a large city like Delhi or a smaller city, a tier 2 city, or in rural part of the country, we will prevent the spread of infection and thereby be able to bring down the number of cases. So it's essential for us to really have that micro planning in these containment areas and then aggressively have participation of the local administration, of the people there, that they understand why this is important and they stay in the containment area. Sometimes people feel that this is just being done and they sort of move out of that area and take the disease and the virus also out, and the whole strategy fails because of that.
And absolutely, and they do not pay caution or pay heed to it and leave caution to the wind. You just mentioned about the surge being contained, and as we speak, we hear that Delhi, the numbers are going down, but this is not the case with the southern states. How would you like to extrapolate on that, sir?
So I think a lot of cities where we saw an initial peak or initial rise in number of cases have now sort of flattened and are coming down. But at the same time, the lessons that we've learned not only from the southern states but from other parts of the world suggest that if you have crossed the peak and your cases have started coming down, it's not a time for being complacent. It's not a time for sort of thinking that you can lower your guard, because the virus is still lurking. It's not that it has gone away totally. And if suddenly we start having, don't follow the norms of physical distancing, wearing a mask, or as we travel and as the lockdown sort of opens up and offices and shops open up, if we are not careful, then we will bring back the infection and more cases will get the infection and there will be a resurgence of cases.
As you rightly said, they have been going down in states where the virus came in earlier, so it is now exiting. But what about Maharashtra? How do you look at that state?
So Maharashtra is a large state. If you look at areas where it happened initially, for example Mumbai, that has done now showing a downward trend. But there are other areas where the cases were not that many in the beginning, have now showing a surge, and this is happening in a lot of small cities in the south, in central India, even in the northeast. And I think there has to be aggressive planning in these areas so that we are able to bring down the number of cases.
So you mentioned about the strategy. The WHO says test, 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 and I think India says, and you say test, isolate, and trace. What is the difference?
So there's actually no difference. WHO says test, and because after you test, you must have a strategy in place. So if you test someone, you must test as many as you can, and those who are having symptoms or are close contacts. But if you test them, then you must trace all the contacts and you must isolate all the contacts, because then only can you break the chain of transmission. So just testing alone is not good enough. Action after testing is also very important, and the action would be to trace all the contacts of someone who turns out to be positive, test them, and isolate them or quarantine them so that they don't spread the infection to others. If you test someone and do nothing, suppose you test an individual and he's positive, and you just say that, okay, you're positive now, you come to hospital or you isolate yourself at home, and we don't track, then the advantage of testing is lost.
Right.
So you have to test, but you have to take action after that test, after that testing, so that the person's contacts are all traced, and these contacts don't spread the infection to others. So that is the important part of the testing strategy.
Sir, can you tell us a little more about the diagnostics? Have you had, those kind of patients who come in with, say, diarrhea or some other disease other than, COVID and not symptoms related to COVID? And how could you give these kind of examples so that we share it with the viewers?
So I think this is something that we're realizing more and more regarding the virus. When we started off, we thought this would be like a viral pneumonia, starting off with the upper respiratory tract, fever, cold, sore throat, and then it would go down into the chest, causing breathing difficulty, cough. And this was what was felt was the classical viral pneumonia, which we see also in H1N1 swine flu, which is also another virus which causes similar symptoms. But as the pandemic progressed and as we came to know more and more about the virus, we realized that it causes what we call a lot of extra pulmonary manifestation, that is manifestations beyond the lung, and sometimes they may dominate. So majority of people will present with respiratory symptoms, but there are a few. And I saw one patient long time back who came with just fever and diarrhea. He told me he had no respiratory complaints. But because I knew that about 20% of people may have diarrhea, we got him tested, we got a CT done, he had lung showed florid changes of COVID and he was positive. But he had no respiratory symptoms and he was monitoring his saturation, which was 97, 98. So you have atypical presentation. In the early part of the pandemic, we had a panic in our neurology department. A young person came with stroke and he did not give any respiratory symptom, history of any respiratory symptom. He had a CT scan done in the department, he had an MRI done, he had another procedure, an MR angiography done for the stroke. And when he was shifted after all of this to the ward, then they realized that the X-ray was not good. There were some shadows on the X-ray and there was some history of fever which had not been forthcoming in the past, and he tested positive for COVID. Obviously, there was a panic in the neurology department. They were not taking proper, at that time, wearing PPEs because they didn't think this person could be COVID positive. The radiology department had a panic because they were not prepared enough for following the protocols because it was not thought that this could be COVID. So we started realizing that a large number of patients may have an atypical presentation and your index of suspicion should be low. It can happen with myocardial infarction, young person presenting with cardiac problem, stroke, or like I said, diarrhea in a few patients. So you have to have a low index of suspicion and test early when you have a patient coming like that, rather than late, because then if you admit such a patient and he is in the ward, large number of patients and healthcare workers can get exposed. So we are now being very aggressive in testing even if there is a slight suspicion that a person may be COVID positive.
And on this note, we are going in for a short break. Stay tuned. We'll be back with more conversation with Dr. Randeep Guleria. Keep watching India Science.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back. As India battles the COVID-19 pandemic, we are in conversation with Dr. Randeep Guleria, Director, All India Institute of Medical Sciences. So before the break, I asked you about the diagnostics. Could you throw some light on the therapeutics part? How are we bracing ourselves to this aspect?
So again, as COVID has progressed and as our knowledge has progressed, we have learned a lot as far as therapeutics are concerned. We started off in the beginning by looking at some new drugs. One drug that we use is used for HIV, which initial studies suggested it may be useful, but subsequent data suggested that it is not useful. It was a lopinavir-ritonavir combination. We no longer are using it. But we realized that there are other drugs which may be useful. Some of them were based on what we call repurposed drugs, that these drugs are already available in the market for some other use, and there was some data which suggested it may be useful for coronaviruses, and therefore it was used. One drug was hydroxychloroquine. There's another drug which came into the market, although the data is not that strong, but it has antiviral property, favipiravir, which is also available in India. These are drugs which are used for mild cases.
Right.
Then we realized that the COVID-19 causes clotting in the blood, which is what we call a prothrombotic state, and it causes clotting in the small vessels in the lungs, in the heart, which leads to the heart attacks, in the brain, which leads to strokes. And therefore, in moderate cases, the treatment strategy changed to use anticoagulants, which keep the blood, prevent clotting in the blood, and now it's a standard protocol that we're using anticoagulants. Similarly, the study which came, initially we were reluctant to give steroids in these patients because there was some data from swine flu or H1N1 which suggested that in that group of patients it can be more harmful. But more recent studies, the recovery trial showed that giving steroids in moderate to severe patients, especially those who had required oxygen, had a mortality benefit. You could save more lives by giving steroids. So it's now become standard protocol. We realize the importance of oxygen therapy. Very often there is these patients what we call a term happy hypoxia. That means they don't realize that their oxygen saturation is low. And we had presented one of our cases in what we do a regular grand round of a lady who saturation was, in your normal saturation is around 97, 98 or 99%. Her saturation was in the 80s, which is very low. But she didn't realize that. She just was feeling a little bit of fatigue. And when someone in the family checked her saturation, it was that low and they rushed her to the hospital. So we are realizing that oxygen is very important and we should be aggressive in oxygen treatment, and therefore that strategy has changed. A new drug which was used for Ebola, remdesivir, is also now available in India, and there was data which suggested that it may be useful in actually decreasing hospital stay, although we are waiting for more data as to whether it's useful for mortality benefit. So that is also another drug which has now come into our armamentarium. There are other drugs which we are using for what we call cytokine storm. As the disease progresses, it's not the virus which causes more harm, but the inflammation in the body as a reaction to the virus, which also starts causing harm. So if that happens, then you have to give drugs against the cytokine storm. One of them, of course, is steroids, but you can also give drugs which we call anti-IL-6 drugs, only in those group of patients whom you find are having the cytokine storm. Because if you give it prematurely or if you give it early, then you are decreasing the normal immune system, which is still not hyperactive, and you may cause secondary infection, which may be because of bacteria, fungus, and therefore we have also realized that when should you give what drug, and a strategy for treatment has now been developed, which I think is helping in saving lives, not only in India but globally.
As we say, the mortality rate in India is very, very different from the other countries. Why is that so? And what is your feeling vis-a-vis Italy, New York, and the other countries, and our mortality rate, if you would like to throw some light on that?
So in India, the mortality rate is low, much lower than what has been reported in Spain, in Italy, and even in New York. And we've done very well as far as that is concerned. There are various theories for this. One widely accepted theory is that we are a younger population. The mortality is related to age, and obviously in the Western, the overall average age is much of the older age than in India, and maybe because we are a younger age group, we have milder disease. It's also felt that it could also be related to the fact that we get a BCG vaccination early in life, and that also gives some degree of immunity. And that may also be protecting us from getting more severe disease. There's also another theory which has been published recently in one of the top journals, and they looked at the blood from people who uh, before the COVID came and found that there were some antibodies against corona which cross-reacted with the current COVID-19 in even these people. And it's felt that maybe there is a milder form of corona which causes just flu-like symptoms, cough and cold, which was circulating in this part of the world. And many of us probably got exposed to that as a common cold and developed some immunity which cross reacts with the current new novel virus, and we are getting protection from that. So various theories, but this is true that in not only in India but in Southeast Asia, the mortality is much lower. If you look at India, we look at Vietnam, Taiwan, the mortality is lower, and it's probably that we have some protection because of many of these factors which I've mentioned as compared to what is being seen in the Western world.
Is there talk of some more immunity boosters, as people are asking, because as a country we're doing not too badly?
So that's another theory, that our let's say alternate medicine or the herbal treatment or the Ayurvedic treatment that we take, or what I would say is home remedies, are they helping us? A lot of people take haldi or turmeric, other people take a lot of other herbal medicines. Whether that is helping our immunity, and that is also something which is used a lot in this part of the world. That is another theory, but I think we need more evidence to say that helps. But it probably is not doing any harm, it may be doing some good.
There is talk about a vaccine coming out, and I think it is difficult to say whether we can compress timelines and get it with a magic wand, but that's not happening. So how soon can India expect the vaccine, according to you?
So normally a vaccine takes many years, sometimes almost 8 to 10 years. And that's because a lot of things happen sort of in sequence. You first do the experimental studies, the animal studies, you have a vaccine candidate, you develop a vaccine candidate, then you do animal studies to see that it is effective. Then you see that it's safe in animals, it's not causing significant side effects. Once you're able to do that your animal data is there to show that there is some immunity that this vaccine is giving, which protects against the infection, and it is not causing any serious side effects in animals, then you go on to what we call human trials. And the phase 1 human trial is basically from the safety point of view. So you select groups of people who are healthy, who don't have any other comorbidities, and who have a very low chance of having a severe side effect of the vaccine, and then you give it to a small group and you study to see that they had no side effects, the vaccine did not cause any significant adverse reaction. Then you go on to the next stage where you look at efficacy, that you see that is it causing good immune response in the body, is it producing good neutralizing antibodies, is the cell mediated immunity good, and if that is good, then you have some idea that this virus is causing some degree of immunogenicity, it's causing some protection, and it may be useful. Then you go to a larger study where you do a phase 3 study where you give the vaccine to a very large number of people, it could be in thousands, and then you expose them, they are in the community, and then you follow them up to see those who got the vaccine as compared to those who did not. Did they get protection and did they not get the infections? So you could vaccinate some people who in the pandemic in a hotspot, and then see over the next few weeks were they protected and they did not get the infection, as compared to those who were also in the same area who got a placebo and got the infection. That is actually the proof of saying that this had protective value. Once you've done that, then you need to do mass production of the vaccine. Now what countries are doing is they're compressing all of this, that you do all of these studies simultaneously rather than one after the other. So you do the phase 1 trial of safety, at the same time you do the immunogenicity study, and once you're ready with that, you start the large study as far as phase 3 is concerned. At the same time, once you get the first 2 data in that it is safe and it is effective, while you're doing the phase 3, you start your manufacturing. Now here you're taking a risk. Suppose it did not work when you did the phase 3 study, your investment in the manufacturing is going to get lost. But we are willing to take that risk to cut short the time, and therefore millions of doses are being manufactured, hoping and with this belief that this vaccine will work, and once we have proof that it works, we can roll it out immediately. By doing that, you actually cut the period of the entire trial to about 1 year or maybe 1.5 years. So I feel that because of all of this, the vaccine should be available by the end of the year. At least some vaccine will be available, and then or by early next year. And I'm hopeful that it may be more than one vaccine. And this is where India has a crucial role, because for two reasons. One is we ourselves are doing vaccines, and this is something that we're very proud of, that for the first time we've made our own vaccine. It's not that we are sort of replicating some other vaccine, we've made our own indigenous vaccines.
And we're going to come to Make in India, sir. On this note, we're going to take a small break. Stay with us. Stay tuned. We'll be back with some more conversation with Dr. Randeep Guleria.
India Science is an internet-based science TV channel initiated by the Department of Science and Technology, Government of India, implemented and managed by Vigyan Prasar. India Science on the URL www.indiascience.in is a bilingual channel with content in Hindi and English. It can be accessed on any internet-enabled device. This video platform is dedicated to science and technology knowledge dissemination with a strong commitment to spreading scientific awareness, especially with Indian perspectives, ethos and cultural context. The India Science mobile app can be downloaded from the Google Play Store and Apple Store.
Welcome back, and you're watching India Science. We're in conversation with Dr. Randeep Guleria, Director, All India Institute of Medical Sciences. Just before the break, sir, you mentioned about a vaccine. And who are the players as far as India is concerned? There are about 100 people already making vaccines as we speak. And I'd like you to elaborate on this first. And then, is there going to be a race, or are we going to be collective as a globe? Or is there going to be some candidate who's going to sort of say that this is my nation's vaccine and do what you like? What are your thoughts on this?
So the first issue is regarding the vaccines. There are, I think, more than 120 vaccine candidates, but around 25 or so are the ones which have gone into early trial, and few of them have now gone into phase 1, phase 2, and some in early phase 3 trials. So it's a very promising picture. And what, like I said before the break, that India is also now into research in vaccine, and a number of companies have started making their own vaccine. And as far as the Oxford vaccine is concerned, there is a collaboration with the Serum Institute of the trials being done in India also, and therefore there will be production also happening in India. As far as India is concerned, like I mentioned, not only is it important from the making the research in vaccine, but the production of vaccine. It's important to remember that currently 60% of all vaccines produced globally are produced in India. So we are the manufacturing hub as far as vaccines are concerned, and therefore we can produce a huge amount of vaccines, not only for our country but globally. So that is something where India has a very strong position. Regarding what is known as vaccine nationalism, that some countries would argue that since this vaccine has been made by research done in our country, it should be given for our own country. That I think is not correct. Our Prime Minister himself has said that we are one globe, every citizen in this country is equal, and we should look at vaccine equity for everyone, no matter what be his nationality, socioeconomic status. And I think it's also important from the medicine or science point of view, because as we've learned, this vaccine has no borders. This virus has no borders. It can go from one place to the other. So if we say that we vaccinate one country and we don't do it in other parts of the world, people will travel, and the vaccine and the virus will keep coming there, and you will not be able to contain the disease in your own country yourself. So I think we have to look at it at a global level. There has to be equity and sharing, and it has to be for everyone, and we have to prioritize it. It's not going to be that everyone will be able to be vaccinated on day one. So whether it's healthcare workers, whether it's the high risk group where the mortality is very high, those are the people that we need to prioritize in terms of getting vaccine first, and that has to be done not only at one area but at a global level. And I think that is something which will come out over the next few months. But prioritizing vaccination and giving vaccine for the whole world, I think, is something that everyone should come together and develop a strategy for that.
Absolutely. You also mentioned, sir, about the Atmanirbhar Bharat, and the Honorable Prime Minister has been talking so much about Make in India and India being self-reliant as we speak. What about ventilators and other testing kits? How self-reliant are we, since we have been exporting the same also to the other countries, even during lockdown times?
So I think this has been one of the great lessons, and I think great achievements. It's also a lesson of how we've converted a problem into something that we could say has become an opportunity. When the pandemic started, there was a huge issue of PPEs, of N95 masks, of ventilators, and a lot of other medical equipments, because all of it was being imported. We quickly realized that when you have a pandemic, there is a global shortage. You have to have your own production. You can't rely on, say, products coming from other parts of the world, because there is now a demand globally and in that area also. So you have to meet your own demands. And this became an opportunity. And therefore, people moved in. We decided to become Atmanirbhar. We decided that we should do something at our own level. So whether it be making PPEs from a shortage. And I remember in the early days, we had this whole problem that there would be less PPEs available. We started a project of how can we recycle PPEs. We developed a whole mechanism of being able to recycle PPEs so that if they're all right, we can sterilize them, we can pack them, and they can be reused, because at that time it was a huge shortage. Today we are in a situation where we can export PPEs. There's a surplus of PPEs in our country. Same is true for N95 masks. We used to have this shortage of rationing them and saying that only you can use N95 if you're in a COVID area. If you're in a non-COVID area, you use a simple surgical mask. Now we have no shortage. Similarly was the issue of ventilators. There was a whole issue that how we were looking at strategies of having one ventilator being shared by two patients. That can we make the tubing like that?
I remember I asked you this question.
Yes. So there was. Yes. So that was a. Now we are
through the algorithm and the AI.
Correct. Yes. Now we have a we don't need to do that. So we have used this pandemic as the adversity as an opportunity to make ourselves self-reliant in medical fields and in various areas. And I think that is the biggest achievement of our country, that we've shown that we are resilient. If there is a challenge thrown to our citizens, they rise to the occasion
and take it head on.
And this is something that we've done.
Yes, sir. But I'd like to ask you now, as you just rightly mentioned about plasma therapy and treatment, and also, do you think there could be a second wave, as people have been talking about, and does the humidity of the monsoons now look at a winter wave? What is your assessment?
So when we talk of second wave, this is something that we know happens as far as influenza is concerned. Right. Because influenza is a disease where we have had data which shows that it comes in spikes, and we see two waves in India. One is in the monsoon months and the other is in winter. And every year there is an increase in H1N1 or swine flu in the monsoons and in winter. This virus is a novel virus. It's different from the influenza virus. Therefore, we are not very sure that this will also cause a spike in winter. It can happen, but we need more data to be very certain about it, but we need to be prepared for it. So I think we should not say that it will not happen. It may not happen, but we should have all preparations made for increasing number of cases, and therefore whether it be our hospital resources, manpower, or the equipment, we should be ready for it. Second issue is regarding whether we will have a second wave or not. That will depend also on two things. One is how the virus behaves, and secondly how we behave. If we are stay vigilant in terms of physical distancing, in terms of masks, in terms of hand washing, in terms of making sure that we don't get into crowded places, are able to avoid crowds, we will not have a second wave. But if we don't do that, as has happened in many parts of the world, there's a resurgence of cases in certain areas, in parts of Europe also, where the cases have really come down. Because once you start opening up, you forget the fact that the virus has not totally gone away, and you give the opportunity,
Lurking behind
yes, you
somewhere.
give the opportunity to the virus to again start spreading, and it is just waiting for close contact to spread from one person to the other, and then the chain starts, and then you start having a new wave.
And then it's unstoppable. Sir, something about children, how susceptible are they in India? Like we've been hearing about a Kawasaki factor. What is that?
So initially we thought children don't get much of COVID-19, and as a matter of fact, in our initial planning that we did in our hospital also, we didn't focus that much on a pediatric area. But gradually we started getting more and more children, and we had to make a separate pediatric cubicle for COVID-19 in our COVID designated hospital. We had to have multiple challenges. We had one challenge where the child was positive but the parents were negative. Now, who will look after the child in the COVID positive area when you have the caregiver is not there? You can't have a child without the parents or at least one parent inside. So, a lot of challenges which are unique to children. We also realize, and this is now globally, that children have a milder disease but are still infectious, and they can have a syndrome which occurs later on, which we call multi-system inflammatory syndrome, which is similar to Kawasaki syndrome, that even after 3 to 4 weeks of recovery from COVID, the immune system suddenly starts reacting in them, causing a inflammatory syndrome, which leads to skin problems, heart problems, and there's an inflammatory reaction which occurs, for which steroids or drug or IVIG is required. Although not that common, but it is being seen in children, and now there are reports occurring from both Europe, UK, and even from the US of children who have recovered coming with these problems.
So, do you think we could have another conversation, sir, perhaps sometimes next year, and not talking about COVID or perhaps of some other virus? Or do you anticipate that we will have a very happy conversation as to how India has battled this? One last question, sir.
So I hope we have a very happy conversation of how India has battled COVID-19, and I think we will have battled it and moved on. But I think we should also not forget the lessons that we've learned and prepare for the futures, because if you look at the last 15-20 years, we've had a lot of outbreaks of novel viruses, from SARS to bird flu to H1N1 to even Nipah virus in the south. So I think this is a lesson that we need to be prepared, and we must keep preparing for the future.
And on that note, many thanks for joining us, sir, and for this wonderful, pragmatic and realistic conversation. And I'd like to thank all our viewers also for joining us today. And the message, as has been given by Dr. Randeep Guleria, is don't throw caution to the wind. Be safe, be cautious. Bharat jeetega aur Corona harega.